Chapter 7, Vitamins. There's a chart in the front of your book which gives you all the RDAs and AIs for all the vitamins and minerals. I don't expect you to memorize the values for any of the vitamins or minerals. Whew. I don't see the point because most students forget this information by the next chapter anyway. Also, they are easily accessible in the front of your book. I'd rather you focus on understanding the vitamin's function instead. There are two groups of vitamins, the fat-soluble vitamins and the water-soluble vitamins. I want to take a quick look at the groups. The fat-soluble vitamins, which are vitamins A, D, E, and K, are found in fats and oils, which is not surprising, require bile for absorption, are absorbed into the lymph, stored in the liver or fatty tissues, and can build up to toxic concentrations. The water-soluble vitamins are the B vitamins and vitamin C. They are absorbed directly into the bloodstream. They're not stored to a great extent in the body, and the excess is excreted in the urine. So this means that there's a lower chance of toxicity. I won't be going through detail on every vitamin, but I want to just touch on a few points in the chapter. I want to start with one of vitamin A's functions, vision. The image seen here, also on page 216 in your book, is a cross-section of the eye. The retina is a layer of light-sensitive cells in the back of the eye. Rhodopsin is a photosensitive chemical in the eye. It is derived from retinol, and retinol is one form of vitamin A. When light strikes the back of the eye, the retina, it changes the shape of rhodopsin. This change causes an electrical impulse to be sent to the brain to register sight. But the rhodopsin has changed shape and is no longer functional. It needs vitamin A to change back to a functional form. Some vitamin A is destroyed each time, so the body needs a continual source of vitamin A for good sight. When vitamin A is not available, there is no electrical impulse being sent to the brain. A flash of light can bleach the retina, changing all the rhodopsin and bombarding the brain with light signals. Without any active rhodopsin, there's a delay in adequate vision again. This is called night blindness and is the first sign of vitamin A deficiency. Vitamin A has many sources. Fortified milk is one of them, but some are not as popular to eat. Example, beef liver. The most well-known source of vitamin A is its precursors, beta-carotene, found in carrots but also in many other fruits and vegetables. Okay, on to vitamin D. I just want to mention that the recommendations for vitamin D have become tricky. It's the only vitamin that is argued about not really being a vitamin. And that's because it's not essential in our diet, because our body can make it when the UV light hits our skin. The problem is UV radiation also causes skin cancer, and more people are wearing hats and sunscreens, and cities have become polluted, very polluted, and those in northern climates, like Northern California, have a lot of fog. All of these factors will block the UV radiation and will block the synthesis of vitamin D. Supplementation is now recommended for infants, and the recommendation for older adults doubles over the age of 50 and then triples over the age of 70. Also remember that vitamin A and vitamin D are the two most potentially toxic vitamins. On to vitamin E. Vitamin E's main function is as an antioxidant. An antioxidant is a molecule which prevents oxidation. Oxidation is a reaction produced by unstable molecules, called free radicals. Free radicals are a normal byproduct of our everyday metabolism. Antioxidants bond with free radicals and they become stable. When left to roam in our body, the free radicals will bind with proteins, fats, whatever they like, and cause damage to our tissues. Antioxidants, like vitamin E, prevent this process. On to vitamin K. Let's look at our main source of vitamin K, which is from intestinal bacteria. We're not making the vitamin K, the bacteria in our intestines are. Vitamin K is given to infants at birth because they have sterile intestines when they are born. Since vitamin K makes blood clotting proteins, this prevents the infants from bleeding to death from a small cut or scratch. Now for one of our most famous vitamins, vitamin C. Its most well-known function is the maintenance of connective tissues by assisting in the formation of collagen. Collagen is a protein that is the basis of our skin, our muscles, tendons, ligaments, membranes, and bones. A small amount of vitamin C is necessary to form collagen. Without it, scurvy develops. Vitamin C is also a cofactor in the production of carnitine, which aids in the transport of fatty acids, and it acts as an antioxidant and it boosts the immune system and assists in iron absorption. Our recommended intake is well above the minimum to prevent scurvy. The recommendation for smokers is higher because smoking causes oxidation and vitamin C is an antioxidant. The nutraceutical dose is higher than the tolerable upper intake. Remember, there are a lot of sources of vitamin C, and it's not just from citrus. On to the B vitamins. Think of the B vitamins as a group. Their main role is to act as coenzymes. A coenzyme attaches to an enzyme to assist in the enzyme's reactions. All B vitamins do this. Most of the B vitamins have a role in energy metabolism. As mentioned before, thiamine was one of the first vitamins discovered. It was discovered by scientists who found what they termed accessory factors in foods that cured the debilitating nerve disease beriberi, which at the time was thought to be an infection. Casimir Funk later isolated thiamine. Thiamine deficiency causes beriberi and a syndrome called Wernicke-Korsakoff's that is seen in alcoholics. Thiamine is widespread in foods. Although it occurs naturally in many grains, manufacturers remove the germ of the grain with the nutrients during processing. Luckily, governments require manufacturers to put these nutrients back into the foods. Niacin participates in energy metabolism. Niacin deficiency results in pellagra, known by its 4 symptoms. The 4 Ds: diarrhea, dermatitis, dementia, and death. Niacin is in a variety of foods, but any food with protein will contain the amino acid tryptophan, which will convert to niacin. Niacin also has a role in blood lipid regulation, but too much niacin can result in what's called a niacin flush reaction. The most important association with folate is its role in the prevention of neural tube defects. In this picture, also seen in your lecture notes, the spinal cord is protruding from the back of this newborn. This is called spinal bifida and can result in neurological problems, including paralysis. When the government started mandating fortification with folate, the incidence of neural tube defects dropped substantially. This is because the neural tube develops within the first few weeks of pregnancy, when most women don't know they're pregnant. Vitamin B12 helps to maintain nerve sheath and protect nerve fibers. So, a lack of vitamin B12 can result in numbness, tingling, and even paralysis. Many students have difficulty understanding why vitamin B12 deficiency develops. The main cause is not typically from lack of intake, but the main cause is lack of absorption. Vitamin B12 is the only vitamin found in animal sources, so vegans can be at risk. But many vegans supplement with vitamin B12, so those at greatest risk of vitamin B12 deficiency are the elderly. As we get older, we lose the ability to produce intrinsic factor. This factor helps vitamin B12 absorb. Vitamin B12 deficiency results in pernicious anemia. This is just one type of anemia. All right, that's it for this lecture. Make sure to read all the reading assignments in the book and the lecture notes.